Candidates for City Council position number 3, the incumbent, Linsey Schromen-Wawrin, and his challenger, Jena Stamper. And to get things started, I'll ask the first question after the candidates' opening statements. Then we'll go to questions from the Rotary membership. All questions, of course, need to be addressed to both candidates. And to ask a question, if you could, please go to participants, the little participants tab, and raise your hand. And I'll know you're there. And to keep things orderly, please don't unmute yourself until I recognize you. Keep it nice and orderly. With that, let's ask each of the candidates to tell us in a maximum of 3 minutes each who they are and why we and our friends should vote for them. And I'll hold up a note to help them when we have about 1 minute left on their statements. Let's start with Linsey. Linsey, you're first on the ballot. Please go ahead.
Thank you, and thanks for having us this morning. It was really fun to listen to your morning banter. I see why you get up in the dark. Hi, my name is Linsey Schromen-Wawrin. I'm running for re-election to my second term on the Port Angeles City Council. I was born and raised in Port Angeles. My dad paints houses. My mom was a teacher at Dry Creek Elementary School, and I now work as a lawyer with my own law office. I chose to come back home after leaving for college and for law school because I know that Port Angeles can have a great vision and not just a great view. We have what it takes to make Port Angeles a place where everyone is better off and no one is left behind. I was honored to be elected into City Council in 2017, and I've been serving with the goal of ensuring financial, social, and ecological sustainability for our community, and in particular for working families, elders, and children. I strive to create a city that provides meaningful inclusion in decision-making that affects our lives. The last few years have been unprecedented. Even before COVID, our community faced the housing crisis and childcare crisis brought on by past governments' poor planning and policies that favored the elite few at the expense of the rest of us. Many working people could not afford to make ends meet. People who are fully employed shouldn't have trouble finding a place to live or daycare for their children. These problems didn't start overnight and they are not easy to solve, but the city is now moving in the right direction even as we face new challenges. I'm hesitant about taking credit for our accomplishments because city council members don't make decisions on our own. And I prefer to stand in the audience at ribbon cuttings rather than on the stage. But I want to name some of the issues where I've helped to make Port Angeles a better place for working families and seniors. So I've been involved specifically in removing barriers to housing affordability and availability for homeowners and renters, in preventing increased homelessness during the pandemic, and collaborating with community partners to create exits from homelessness for local residents, supporting proactive police and fire responder programs, restarting the city's code enforcement program, addressing the childcare shortage crisis, decreasing utility rates for the average customer, supporting downtown revitalization, small businesses, and new manufacturing industries, expanding bus service to better serve the whole community, maintaining the waterfront trail, advocating against unfair taxes that benefit those who already have more at the expense of those who have less, and planning for our long-term financial, social, and ecological sustainability. We certainly have more work to do on these issues and others, and I'm happy to have the opportunity to serve again for another 4 years in order to continue this work. Obviously, I would be honored to have the votes of the people of Port Angeles this November. Thank you.
Thank you, Linsey. Jena, over to you. Oops, we need to unmute there. There we are. Right.
Thank you, John. Good morning, everybody. Thanks for having us here today. It's bright and early, and I appreciate a reason to get up this early. I just want to, my name is Jena Stamper. I know it's spelled a little funny, but it is Jena. I'm a Port Angeles native. I've lived here for about 30 of my 37 years on this earth. I'm a local business owner, a property owner, both commercial and private. I'm a mother and a landlord. I have a well-rounded perspective of the city and the challenges that face it. I was drawn to run for city council to really help make a positive change in our community. We face some challenges that are unique to our specific community, but also not unique to a lot of cities in our country. I feel that public safety is a significant challenge that faces our small city. And as a parent, even frequenting some of our newest parks, we face concerns of even sending our children to the bathroom, especially by themselves. I want to be a strong advocate for code enforcement and our police department, and make sure that they are funded to their fullest extent while keeping within our city budget. I want to continue to make sure our emergency operations center gets completed within a timely fashion to ensure the safety of our community, while also looking ahead for climate issues and what we can do to make sure that our city has plenty of water if that time ever comes. I believe a strong economic foundation is very important to our city budget and to the overall health of our community. I would like to be a part of lowering barriers for our new businesses to thrive within our business sector and take some of these mandates and barriers off of our businesses who have been struggling over the last couple of years. I would like to continue to develop high-performing relationships with the partners in our community and ensure that our city is transparent and easy to work with. Our community is facing a housing crisis like many other cities in this country. We have amazing local builders that have done their best to keep building, even with the challenges of COVID and staffing issues. I have been attending the EDC meetings, trying to understand some of the unique challenges of our community so I can hit the ground running with policies to lower barriers for our builders. I have spoke many times before in this campaign that I want to be a strong advocate for our neighborhood parks. Our parks are such an important part of children's mental health. And when you talk about a more walkable community, that is something that's very important to neighborhoods and our real estate. Selling real estate in our area, that's a huge plus for selling homes in certain areas. Let's see here. Our park staff does a great job, and they have quite an inventory of parks to take care of. And I understand that, and I understand the issues, but I have some really innovative ideas that can help with this to replace some of the parks that have been taken down, and ideas to help maintain the other parks and bring them back to their full glory. I would like to.
Gina, we hit the 3-minute
okay.
limit on that.
My primary goal is to work with our city manager and public works department to clean up the physical aspect of our city. That would be my main goal if I were to get in city council. I have a problem-solving mentality, and I would love to bring some of those problem-solving, oh my gosh, to our community. Thank you. It's early.
All right. All right, let me ask again the first question. In your opinion, what's the most important challenge that will face our city in 2022? And how should this challenge be addressed? Gina, I wonder if you could go first on that. What's the most important challenge that's going to face us in 2022?
That's hard to predict, but right now, I would have to say with the climate, it's the divisiveness of what these mandates are doing to our community. So as a council, finding ways to bring our community together to support our local businesses and help them thrive while keeping our community safe.
Okay, over to you, Linsey.
Yeah, I would have loved to give this answer for 2021, but it's probably a 2022 answer and maybe a 2023 answer, which is pandemic recovery. Quick estimates from census data show that there's probably 1,000 plus or minus 200 rental households in Column County that are behind on rent. There is an amount of funds available for tenants to apply for relief from those COVID rental arrears, but I'm not sure that fund source is going to fit the need. And we're going to be dealing with that issue for a while, I think locally at the city level, county level, state level. Other aspects of COVID recovery, are we going to still have the Coho Ferry? We as a city just put $500,000 of American Rescue Plan funds to the Coho. We still have 3 million of those funds in reserve, not yet allocated. And if we need to, I think we should put more toward the Coho. They've kind of fallen through the gaps of different relief programs due to being a private international ferry. And so, thinking about how do we maintain what we had before the pandemic and not lose vital parts of our community structure.
Okay, again, questions from the membership now. Again, to ask a question, go to participants, raise your hand. And let's go with Scott Butler, our president. Scott?
Thanks, John. First off, Jena and Linsey, thank you so much for joining us this morning. We appreciate you being with us. It's an honor. We appreciate you serving our community, and it's vitally important to all of us. So your views being shared will help us in the upcoming election. So my question to each of you is homelessness versus zoning. My mom lives on Milwaukee Drive on the west side of town. And on the corner of N Street and Milwaukee Drive, the owner of that corner lot was going to subdivide his lot into 17 smaller parcels for help out with the homelessness, which needs to be addressed. But what happened was a lot of the homes along Milwaukee Drive, including my mom's and other of our members live on that same street. They, it was right there at the corner as you're coming in down the drive, and they were concerned about the effect on their housing prices, the value of their homes. So addressing homelessness is important for sure. But how do you, if a measure was to come in front of the city council to allow that to go into 17 subdivided lots, how would you vote? And then how do you as on the city council balance the value of people's homes and zoning versus making sure that the homeless
okay. We got basically a two-part question there. Linsey, could you go first on this one?
Yeah, I'm going to try and keep it short. I obviously, as this group knows from my presentation earlier this year, I can talk about homelessness and housing issues for a long time. So briefly, it might not be an issue that comes to the city council. It might go to the hearing examiner, in which case the city council doesn't weigh in. So we don't have a say in certain decisions. And that's partly, that's something a lot of cities have done because those decisions are often very technical and usually something that is better done by a technical expert rather than the city council. There's a lot more detail there, but it might not be a city council decision. In terms of creating more density, I think that we should follow a model where the densest part of towns are near the densest part of the city are near the center of the city, and then we get less dense as we move out. I'll actually drop a link in the chat that has an illustration on that page of kind of what that's talking about. So, in Port Angeles is a good example. We have this really dense downtown. If you look at an aerial map of it, those buildings take up the entire lot from sidewalk to alley. You move outside of there and, where I live at, Cherry and Third, we have, high density housing, although, there's apartments scattered through the area, but it still generally has a standalone detached house feel. When you get out to, N and Milwaukee, that's very much, standalone houses. I'm not sure where the nearest apartment would be to that area. So while we should, I think, thicken up the, probably all of the different zones in Port Angeles, meaning be able to have, cottages, the mother-in-law, so to speak, the accessory dwelling unit in the backyard in different ways. It shouldn't affect neighbors in, I think, the way that you're concerned about. So if we're doing it right, it's not going to be something that is detrimental to the character of the neighborhood. And that's part of the goal with the form-based code revisions that started on Wednesday evening in terms of a public process. Well, actually, it started with a public process over the summer, but kind of the public hearing process started at the Planning Commission on Wednesday evening of this week. And that's mostly about the commercial corridors, though, not about areas that that you're describing. And then I just have to push back a little bit about property values. And it's generally assumed that more housing in an area might lower property values, but there's no evidence for that. And the real estate economists who look into that question find that there's no connection between increasing density in an area and lowering property values for the existing property owners. So I just want to push back against that. It's not a threat to existing property owners to have more housing nearby.
Okay, Jena, can you take a shot at that?
Sure. I'm a big believer in protecting your property values and property rights. And I would have a lot more questions when it came to this is how big are these lots? Who's the builder? What are they going to look like? What type of tenants are they going to be having and how is it going to be run? What kind of rules are going to be in place? The nearest apartment buildings to that area, I would have to say, is the Fairchild Heights over there on 18th Street, which I've heard a lot of voiced concerns in that area about property crimes and the visual aspect that comes along with people parking on the streets and garbage that then comes out of their vehicles and sits there. So I think it's absolutely a concern of that neighborhood to be concerned about their property values. And I would have a lot more questions. And like Linsey said, it might not come before the city council. So you can't really, say for sure, but I would definitely have a lot more questions and I would probably have the best interest of that neighborhood in mind. And I do know that we do need more density, but maybe that's not necessarily the right area for it.
Scott, is your question answered, do you think?
Yeah, thanks, John and Jena and Linsey for your answers. Thank you very much.
Okay, let's hop over to Laurel Black. She has a question. Laurel?
Good morning, and thank you for coming to talk to our Rotary. It's always good to be able to speak directly to candidates before an election, and that's one of the things I appreciate about living in a smaller community. My question also is about housing, but I'd like to take it up a few thousand feet to a higher policy level. I would like both of you to talk about how you view the role of the city, generally speaking, in supporting and expanding housing accessibility, not only in relationship to combating homelessness, but also in relationship to supporting family jobs in this town and the economy.
Jena, let's have you answer that one first.
Sure. I think our city staff does a great job of trying to find innovative ways to bring larger businesses to our community. Our port has a huge capacity to facilitate some larger employers in this area. And I think that I would like to be a strong proponent of coming up with some ideas to help them find companies that would be willing to do that. But like we say, there's a housing problem. We need houses for these workers. So it's a catch-22. But I do know that there is a housing development with all the permits pulled for, I believe it was 120 units up on North or South Laurel. So, I mean, there are things that are happening. They're happening slower. So as a city council person, what we could do is make sure that our city is easy to work with, that the permitting process is streamlined, that when people and builders call to make these decisions, that our city answers and that the process is easy to navigate. We have to support our local businesses. We have so many great builders in our community, and they would love to, help with this problem. But there's a lot of barriers, and I know a lot of them come from the state level. But as a city council, we could help petition the state and some of these policies that have come down, and to encourage our builders to keep on keeping on. Thank you.
Okay, Linsey, over to you.
Yeah, and as Jena knows, at our last city council meeting, we're talking about 4 legislative priorities in 2022 to ask the state to slow down the rate at which it changes the building code. So we're generally preempted. We're required to follow the state building code as a city, and that is where a number of regulations come from. That said, The city also has regulations that I don't think serve as protections in the way that Scott was asking for in the previous question, but rather serve as barriers. And we need to cut that red tape and remove those barriers so that there's more housing choices and there is enough land capacity zoned appropriately for us to accommodate the infill population that we are going to be seeing on the North Olympic Peninsula. And so how do people move to the peninsula and move into the city so that we don't see a lot more basically rural sprawl? I mean, I could imagine if we don't get this right in Port Angeles and in Sequim, that it could be an hour drive between Port Angeles and Sequim, because we're just going to see people building out of the city rather than in the city. It should be easier to build in the city than in the county, because that's where basically in the big scheme of growth management statewide, and also what probably makes the most sense for us, that's where we want to accommodate population growth. And we can do that and make the city a better place, because when we get to slightly higher densities in neighborhoods, we're able to have commercial satellite areas, we're able to have walkability and more livability in our urban space. So it's better, it's a win-win for the urban space and the rural space when we look at how we can make Port Angeles basically more livable in the urban form. I hope that was the height level that you were looking for with that question.
Laurel, did they answer the question?
Yes, I think they were both very clear and I appreciate it.
Okay. I don't see any other questions. Let me ask a question to the candidates. And do you think our downtown is healthy and successful? And if not, what actions would change that? And Linsey, you're up first on this one. Is our downtown healthy and successful? If not, what actions would change that?
Well, let's open the international border. That would help. But I mean, that is a huge transportation corridor that is just shut right now. And it's been that way for a while, as we know. We have seen unprecedented development in downtown. I mean, I'm trying to think of when the other major developments, I mean, like the Elks building is probably the biggest building in downtown. And I don't remember when that was built, but the Field Center, the Al Wakalam Tribes planned hotel, a mixed use apartment, condo, commercial space. We're seeing a number of investments in downtown that we haven't seen in a while. I think that's a really positive step. The city's role, kind of going back to the earlier question as well, I see the city's role as creating the environment in which businesses can grow, in which businesses can be successful. An analogy would be maybe, creating good soil so that when you plant a seed, it's going to be healthy and thrive. The city doesn't do this. The city isn't the plant. The city is the soil, right? And we need in downtown to make sure that things that we manage, like our street system, like our parking system, are things that are conducive to a healthy downtown. So I'm happy to talk about parking more if that's the direction people want to go in. But in terms of streets, one of the projects that we've had in the capital facilities plan for a while, and which came from the 2009 American Institute of Architects Sustainable Design Assessment Team study, is to recouple First and Front Street, which means turn them from one-way streets into two-way streets, and slowing down traffic and making traffic more connected to the space that's moving through is really helpful for commercial areas. And so what we have right now in downtown Port Angeles and continuing all the way up to Golf Course Road is what some urban planners call a strode. It is a street and a road, and it doesn't serve the function of a street and it doesn't serve the function of a road. A road helps you travel fast. A street helps to create an urban space and get you where you need to go. And a strode doesn't really do either very well. So especially in downtown, I think if we can solve a lot of these transportation issues, we can make a downtown that's much more conducive to I think health is the way that John put it. I mean, one example right now during the pandemic, a lot of cities have moved to allowing outdoor dining. City of Port Angeles is amenable to that. I haven't seen a lot of businesses pursue that. And I think personally, and this is just anecdotally, a big reason is that it's really loud on the street in First and Front Street in downtown Port Angeles. It's not a very pleasant spot to hang out because there's a lot of traffic and often some really loud traffic going through.
Okay, Gina, is it healthy and successful downtown in your opinion? And if not, what should be done?
I hear from a lot of business owners downtown that business is good despite the fact of not having the coho running through. And I think that is something that we need to think about into the future is what if we do lose the coho, which would be a terrible thing, but it's something we need to think about as a council and what we are going to do to ensure the future safety and successfulness of our downtown. So being innovative and looking for ways to bring other attractions to our downtown that will still draw people there. And I think that we really have this this diamond in the rough with our waterfront that's happening in here with the playground equipment being removed, and it's kind of being taken over by some homeless camps. And I know we're doing the best we can, our police department, with keeping those cleaned out and the safety on our waterfront trail. And they always do a great job. But if we were to, these big open spaces that we have, these parks, but to bring more attractiveness to those green spaces, like in front of the Fielder Center and the waterfront, to draw more people down there to frequent our downtown businesses. So I totally agree with the streets and the loudness of the traffic, but there's other innovative things that we could do down there besides, like, maybe we don't need Oak Street to go all the way through. Maybe that could be a covered area parked out with, what am I thinking? A maker's market that can come and go as you please. Something like that to help the businesses, like you can get the food and then just go to our area that's covered, because we get a lot of rain. So just thinking ahead and being a problem solver of things that, what if this does happen? And we need to think ahead for things like that. But I do think it's healthy, but it needs some help.
Thank you, Gina. President Scott Butler has another question. Scott?
John, there's nobody else, John? I'm the only one with the hand raised. Huh?
How do you do the hand raise?
Okay, I'll go ahead and ask a question. During our last week's forum, the health mandates was a contentious issue. You've both been in the paper about this. Sequim City Council recently undermined the health mandates. So this is a current issue of the day, right? So we all want to get out of this pandemic. I'm tired of doing things by Zoom. I'm a huge proponent of vaccinations and protecting others. So how do you see the city council? What is your view on the health mandates? And then as a city council, how could you help get us out of this pandemic quicker?
Wow, big one. Okay, Gina, could you go first on that one?
Oh, sure. Okay, so I don't think we're ever going to be out of this pandemic. I think this pandemic is really going to end up being endemic. It's going to be something we live with, like the flu. And honestly, I think it could have been done a long time ago had we not locked down and just let people, do their thing. I think hand washing and distance is always important, but I'm always going to be an advocate of medical freedom and not mandating to our public any medical procedure for any reason. It is their body. They should have the sovereignty over their own body and make their own choices. I could go on for days about other stuff, but I will just say that that's my stance. I don't believe in putting mandates on our businesses that are already crippled. If we didn't have a mandate, we wouldn't have protests. We wouldn't have discourse. We wouldn't have people up in arms about it. There wouldn't be discrimination at our restaurants. It's something that has created, in my opinion, more of a problem than we had in the first place. If we would have just let it run its course, washed our hands, had good health practices, maybe talked about nutrition and healthy eating. These are things that are really going to help our community. When you talk about mental health issues and what our children are facing, and everybody with their Zoom meetings and not having that personal contact, that is what health is truly about. And I don't think it's hiding from each other or covering our faces or pushing medical treatments on an entire population, because no medical treatment is going to work for 100% of a population at any point in time. So that is my stance on that.
Linsey, over to you.
Yeah, so I mean, it's not about 100%. It's about reaching a level where we can ease the non-pharmaceutical interventions and not have our hospital over capacity and having to triage patients. I live in one of my neighbors is a respiratory nurse at OMC, and talking to her, I mean, she's just, dealing every few days she has somebody die from mucus in their lungs, and they're basically suffocate in their own lungs. And I just, we're talking across the street, and like, I just feel for her so much, and I want us as a community to not be putting people through that situation, whether they're the patient, the family of the patient, the people who are caring for the patient. And we can do that. So let's talk about medical freedom. Freedom doesn't include the right to put other people at risk. If we're a live and let live community, but it's not just I want to live the way I want to live. It is that I'm going to let other people live too. So Dr. Berry was attempting to keep schools open. As we saw the Delta variant move voraciously into Clallam County, she said, there's a huge impact from closing schools. We've seen that. And that hurts some of the most vulnerable kids the most. So she wanted to try to keep schools open. In order to do that, she felt like she needed to reduce the transmission of SARS-2 through the community in other ways. And she said very clearly, and watching the Emergency Operations Center meetings, they're 10 p.m. on Friday. You could kind of see this coming in her briefings in the previous weeks, that wearing masks is very effective, especially this virus transmits indoors. She's basically said this is an indoor transmission virus, but you can't wear masks when you're eating and drinking. So she had a choice with this high transmission environment of restaurants and bars where you can't wear a mask, of doing capacity limitations, shutting them down completely, or doing a requirement for vaccines in order to eat inside. She only put in place the vaccine requirement for indoor dining, not for takeout, not for eating outside. And as soon as we get down to the point where we don't have this high transmission load in our community, she's going to lift that. She said that, right? So I don't see this as a medical freedom issue. This is how can we take responsibility to protect ourselves as a community together? And sometimes that means sacrifice, right? Nobody wants this pandemic. Everybody's ready for it to be over, right? We did a great job as a community for around 18 months with this pandemic. Like, we were leaders in the state in so many ways. And then, over the last, we just haven't done it well with Delta. And I think, honestly, the governor messed up in taking away basically all the non-pharmaceutical interventions over the summer, kind of saying it's over. We had a couple awesome weeks of big concerts on the pier and that sort of thing. But now we're really back into it, and it is there is this divisiveness. I don't think it's splitting our community the way that Jena's describing. I think that there's a small group of people who, honestly, the research is out now. They're being supported by the same people who supported the January 6th coup attempt in Washington, D.C. Groups like the Proud Boys are involved in these protests against what they call vaccine mandates. As the city goes, we currently do not have a requirement for city employees to be vaccinated. because so far we haven't seen employees being infected be something that has impacted city services. I think the question would become, can we continue to operate the water treatment plant or the sewer plant if we have a lot of employees getting infected, having to do extra quarantine time away from work and that sort of thing. But I think it has to be case by case. I'm not interested in, requiring people to be vaccinated to be able to come to the government or speak to their government, right? Everybody should be able to do that. But being able to eat inside in a restaurant, that is a small sacrifice to make at a time when people are drowning in their own lung mucus. So, let's put this all in perspective. Thanks.
Laurel Black, you have your hand up again. A question?
Yep. Yeah, I have another higher level philosophy question. One of the things that's come up for me a lot as I hear the back and forth on mandate yay, mandate boo is I hear a lot of people getting very upset and exercised about what they perceive as their rights. I have heard almost no discussion about people thinking about what their responsibilities are. And I would like both of you to address that and give your views on how you see the relationship between rights and responsibilities.
Linsey, we've got you coming up first on this.
Well, that is a really great philosophical question. Feel like we should sit around at a bar when this is all over and talk about that. But so rights and responsibilities are, to me, kind of the flip side of the same coin. But one thing that we do in the United States is we look at the responsibility. The rights are held by individuals, and thus the responsibility is held by the government to not violate our rights. And that framework is, I think, part of what allows people to say, what, the government isn't letting me eat inside without being vaccinated against the SARS-CoV-2 vaccine or virus, that violates my rights, my freedom, because we only look at the responsibility to not violate rights being held by the government. And I think that's sort of a problem in the way that we've thought of government in the US for probably the last 250 years. But generally speaking, we do have a responsibility collectively to ensure health, safety, and welfare for everyone with as little impact to people's individual rights as possible. But there's no fine line. And when courts look at this issue, they say, is the right infringed? Yes. But is the right violated? Maybe not, because the government had a good enough reason to issue that order, make that law, create that policy that infringed on the right, but did not violate the right. So that's the analysis that courts use, and that understands this balance between the collective process of what we do as a community, what government should be, and our individual civil liberties and civil rights. That said, we are stuck in this framework, as I just described, of government versus the people in a way, which is kind of strange, because if we're really aspiring for a democracy, government should be the people, right? We should be so intertwined in our government, our collective decisions about what we do as a community, that there is no difference between government and the people, government and society. It should be one and the same if we're really striving for, I think, an egalitarian and democratic system of how we make decisions for ourselves.
Jena, over to you.
I like how Linsey tried to separate that infringement versus violation. Without the individual, there is no collective. And so if we're going to infringe on individual rights, to me, that is a violation. I think everybody has a responsibility to protect themselves and to protect other people. But when you make it very specific to COVID, let's say, and someone made a personal decision, and yes, these people make this decision not lightly, and they know and have done their research on why they choose to do or to not do a medical intervention for their body. And that's their choice. people make choices every day. People choose to smoke cigarettes every day. And are we going to discriminate against someone who comes in with lung cancer? Are we going to discriminate against someone who ate Twinkies and Ho-Hos their whole life and now come in with heart disease? We can't discriminate against people for making a choice in their life that they take full responsibility for. I do think that we have a responsibility to our community that if you're sick, stay home. But to say that a vaccinated person can eat out, when science has shown that a vaccinated person can transmit the virus asymptomatically even, what are we differentiating against then? And why aren't we looking at natural immunity? Our community has, Delta variant has just gone right through our community, right? There's been tons of people who have been infected with the Delta variant. So now these people have natural immunity. And to discard natural immunity and say, well, gosh, we don't know how long they'll be protected for. Well, the science has also shown that we don't know how long the vaccine is effective for, hence the boosters coming out. So you can't discriminate against someone who has had COVID, who has natural immunity versus someone who doesn't. And how are we supposed to put that burden on business owners, on hostesses, on waitresses, that they should discriminate against one person or the other? It's just, to me, it's not right. We need to give people their individual freedoms to move about our country, to let commerce be free, and to really not put these burdens on a certain industry like this. They've already been hit time and time again throughout this pandemic. You're talking about life and liberty and their pursuit of happiness, and we're putting stipulations on their life and their liberty and their pursuit of happiness. So I don't think there should be discrimination. It's something we are going to have to live with. And let me say, I do not take COVID lightly. I have parents who are in their 70s who got COVID, and it took me a month to get them better. A month. It was terrible. So I understand the severity of this virus. And I appreciate the heck out of our, some of our medical community and the choice that they make to honor their Hippocratic oath. Others, not so much. They decided that, since my parents happened to be unvaccinated, and the first doctor that we saw at the hospital said, well, I guess I cannot help you. And the only reason we got care is because I knew another doctor who I called and I asked her to care for my father. So, and this was, they needed at that point in time, since we're very naturally minded, they needed a little bit of help. They needed fluids, they needed this or that, but to be treated like that because of a medical choice that we take full responsibility for, to me is just wrong. But our community paramedics are amazing. It's an amazing program that I would like to help fund on a more permanent level. They can go out and help people where they are instead of flooding our system, our medical system. And I think that that's something that I would look into more in the future as a council member.
We're approaching our 8 a.m. Let's go to the closing statements if we could. And Linsey, you could, I think, address some of this we just heard, but 2 minutes each, please, if we could. And Jena, let's start with you first on your closing statement. 2 minutes.
All right. So I really enjoy getting to talk to you guys today. And I know some of these issues we're never going to see eye to eye on, and that's okay. And that's what our council should be. Our council should be a diverse array of people who represent different portions of our population. And I think right now in our community, there's a large portion that feel that they're not being heard, that there's immediate concerns in our community that our council, which I think our council does a good job of planning for the future and the vision that we see for our downtown with the streets and the parking. And I think that me and Linsey kind of see eye to eye on how certain things should be in our city in the future. And that's okay. But campaigning and the process, the political process, is really important. Competition is important because it makes you be better. And it does say, you know what, Linsey, I think you're doing a great job planning, but I don't think you're doing a great job of addressing the issues that are currently happening in our city. And I know that we want to be compassionate to the homeless people in our community, and I am absolutely want to be compassionate also. But I will not stand for our memorials being desecrated and feces in our parks and the needles And there's things that need to happen and policy that we can figure out that's going to help with these issues that are currently facing our city, that people come to me and talk about. And I have restaurant owners that come to me and just say, you know what, I just closed my dining because I will not discriminate against people. And I completely respect them for that. So I want to be the voice of the people that I don't feel like are being heard on our city council. And that's what empowered me to run. And I hope that when you get your ballots in November that you might vote for me, Jena Stamper. Thank you.
All right, Linsey, over to you.
Well, Jena, thanks for some of those comments. And I really agree that competitive elections are really important. As an incumbent, I honestly don't know how to run as an incumbent, right? Because there's so much more work that needs to be done. And, Jena's right, like there's a lot of issues that are not yet addressed. But part of it for me is knowing what we're running for. So city council is the policy and long-term planning body for the city. We are not the ones out there, on the streets cleaning up parks. Like we can do that in our volunteer time, absolutely, but that's not our role as city council members. We had 5 openings on the Parks and Recreation and Beautification Commission earlier this year, and I would have loved to see Jena's application for that, because that's a space where we have community involvement directly in how the Parks and Recreation Department is operating and bringing ideas and important ideas to the City Council for implementation. I also want to specifically speak to, listening to the community. At the beginning of the pandemic, I was, trying to understand, okay, what is this we're dealing with? Why are we doing these unprecedented things like, like non-pharmaceutical interventions, shutting down businesses and that sort of thing. And so, I was following arguments like the natural immunity argument that Jena is making. And I want to be clear, I hope that natural immunity is highly effective, because for us to solve this pandemic globally, I mean, with 7-8 billion people on the planet, if everyone who's infected with COVID gets long-lasting effective immunity, that's going to be hugely beneficial to this pandemic coming to an end, hopefully just being an epidemic, hopefully being something less, but likely still an epidemic. But here in the US, if we implemented the natural immunity approach, as some people were advocating early in 2022, we would have seen overwhelming hospital overcapacity. And I mean, literally, like, who's ordering the refrigerator truck for the bodies? And if you look at Clallam County, we have about 76,000 people in Clallam County. At this point, 48,000 have their first dose of the CoV SARS-2 vaccine. About 4,000 have a confirmed case of COVID. It's not my spot to second guess. John, you're asking me to stop. So I will stop there. Appreciate this conversation. Happy to answer questions now or in the future.
Thank you very much, Linsey and Jena. Thank you very much for being here. You might put your contact links or something into the chat if you'd like, so people could follow up with you if they have any questions. And with that, let me return the program to President Scott.
So Linsey and Jena, thank you so much for joining us this morning. This was, we appreciate hearing your views, and well done. And we highly appreciate your service to our community.
Absolutely.
Mr. Brewer, thanks for doing such a bang-up job on the forum, as always. And Tom, thanks for the tuna can collections being driven in, and I appreciate everybody's donations there. Just closing out, this reminder, 14th of October will be our first social. It'll probably be at Field Music Hall Tour, then we'll go over to Bar Hop. And then re-announcing our first ever 2nd of November guided salmon fishing trip. We got 9 slots. I've got John Tykert, Sean Simmons, Norm, Steve, and Brian. And I know, Sean, you need to close out, but I want to re-announce it because we started early, and I'm not sure if Chris, you heard it, or Mark Nichols. It's going to be with Nick Hendrickson and Mark. I'll tell you, Steve and I heard for about 4 hours how awesome of a fisherman you are, and I guess you and Nick are pretty close. So 2nd of November, if you want $275 per person, 9 slots. If you want to sign up, just let me know, and I'll keep going next week too. So thank you, everybody, for your great questions. And John, thanks again for.
And again, big thanks to Linsey and Jena for being with us this morning. Thank you.
For sure. And I hope everybody has a great week.